Hello and thank you for joining us today. So today's session is titled I've been diagnosed with IBS, what do I do now? So before we start, a few introductions. My name's Leah Seamark and joining me today is Marianne Williams. We're both specialist gastroenterology dietitians working for Somerset Partnership NHS Foundation Trust, and we also have a colleague, Kerry Marchant, who helped put today's sessions together. So to go along with this webinar, there are various handouts that you can download, and you can find them on our website, which is www.patientwebinars.co.uk. And the handouts which are available on there include the IBS food fact sheet, which was produced with the British Dietetic Association and NICE, a fact sheet on calcium intake, a general information sheet about the FODMAP diet, a handout on constipation, and a fibre fact sheet, which again was from the British Dietetic Association. So this webinar is particularly about IBS and diet, and it's based on some of the dietary advice available from the latest national guidelines. But in addition to that, we're going to cover a few topics which we often get asked in clinical practice. So it's to answer some of those questions which often pop up in our clinical sessions. In terms of the topics we are going to cover, it includes the general dietary research and lifestyle advice, including alcohol, caffeine, spicy foods, and high-fat foods. Talk a little bit about dairy and gluten in IBS and the roles they may play. Probiotics. We're going to answer the question of whether food allergy is relevant in IBS. Touch briefly on the low FODMAP diet, and then really talk about what you should do to help with your IBS symptoms. This webinar will not cover everything, so some of the topics we won't be covering today include the other medical conditions such as IBD, which is inflammatory bowel disease, or celiac disease, both of which may have similar symptoms to IBS. Medications, so there are various medications which can be beneficial in the management of IBS, but that is beyond the scope of this session. Investigations and surgical interventions, blood results. We're not going to be covering too much about anxiety and stress related to IBS. However, we are aware it's an important trigger for symptoms, and we're not going to go into a huge amount of detail about psychological causes for IBS.
Before considering dietary intervention, I think it's really important to check that dietary intervention is really relevant for you and your IBS. I mean, stress and anxiety that causes irritable bowel syndromes may actually be better dealt with using medication or cognitive behavioural therapy or hypnotherapy, for instance. It's really important that those with a history of anxiety associated with food or eating disorders, or perhaps you suffered from acute or chronic health conditions that already compromise your nutritional status, then really those people should be seeking specialist dietetic advice before following any dietary interventions, and we would not recommend this webinar would be suitable for those people.
So before we get into looking at diet and IBS, we just want to quickly touch on a condition called diverticular disease, and it's just really to highlight that diverticular disease is not IBS. So diverticular disease is when these little pouches appear in the lining of the large intestine.
But I don't know about you, Leah, I often get patients coming who've been for a colonoscopy, for instance, and they've been diagnosed with nothing in particular apart from they've been told they've got diverticular disease. And of course that can sound quite dramatic, but it literally is a very grand way of describing these little pockets. Of course, they're very relevant if they get infected, but in most people that doesn't happen. A lot of us live with these tiny pockets and they never get infected and never cause any problem at all. So a lot of us have diverticular. It's whether you get diverticulitis, where it gets infected or not, that's relevant.
And when we look at diverticulitis, it's associated with other symptoms, isn't it, beyond the sort of IBS type symptoms? Yeah. So it's associated with constant and severe pain, a high temperature or fever, feeling sick or vomiting, whereas mild diverticulitis might be treated with some antibiotics, and in more serious cases, it may require hospitalisation.
So it's a very different condition to IBS. I think there just ends up being a bit of confusion there when people are told they've got diverticular disease, and then they think they get a bit confused as to whether it's IBS or diverticular disease that's causing their symptoms.
Absolutely. So, talking about some of the symptoms, it's just really important to be aware that if you have any of the following symptoms, we would recommend that you see your GP. So if you have any blood in your stools, any unexplained significant weight loss, unexplained low iron levels, sudden change in symptoms, or waking at night regularly with your gut symptoms, it's really important that you go and speak to your GP so they can look at your symptoms and consider whether any further investigations might be needed.
And I think these symptoms are often called red flags, and that's because you need to have further investigation quite often if you have any of these symptoms. So you, by all means, look at the dietary intervention advice that we're giving you today, but do make sure as a priority that you go and see your GP first if you've got any of these red flags.
And it's actually just important to mention, so this webinar is for people who have actually already had a medical diagnosis of IBS, and whether that was from your GP or gastroenterologist. So we want to make sure that you have a proper diagnosis of IBS before you consider some of these interventions that we're discussing today.
Yeah, absolutely.
And as part of that diagnosis, it's likely that you may have had a blood test to rule out a condition called celiac disease. And this is recommended by NICE, which is the National Institute for Health and Care Excellence. And it's really important that if you have IBS type symptoms, that celiac disease is excluded as a cause for that, because the symptoms can be very similar.
Yeah, absolutely. And there are a large proportion of people with celiac disease who were initially told they had IBS. So yeah, definitely, if you've got IBS symptoms, have a celiac disease test done at your GP surgery. Very simple blood test, very easy to request.
So talking about some of the symptoms related to IBS, they do range from person to person. So it could be a combination of suffering with mixed constipation and diarrhea, or it may be that you just have constipation or diarrhea in isolation. Other symptoms we often hear about is urgency, so that urgent need to get to the toilet to open your bowels, excess wind, bloating, so sort of distension of the stomach, abdominal pain, nausea, reflux or gurgling. And every person's individual, aren't they, Marianne? So we sometimes see people who have all of those symptoms, or we have some people who may just have one or two of them.
I often see people really, and wind and pain and bloating are their main symptoms. They don't have any of the other symptoms. Their stools might be quite normal, and dietary intervention can still help those people. So you don't have to have all those symptoms to have IBS.
And the question of why do people suffer from IBS type symptoms, and it can be triggered by a range of different situations, including gastroenteritis or a bout of food poisoning. And often we may see people who have had, say, food poisoning years ago, but it's since then that their stomach symptoms have been an issue. Using a range of medications that can alter the gut bacteria, including antibiotics or non-steroid anti-inflammatory drugs or PPI, so protein pump inhibitors, they can all affect the gut lining, which can then lead to symptoms. Any gut-related diseases, so things like inflammatory bowel disease or celiac disease, which can affect the stomach and the large and small bowel. Any surgery affecting the gut, so that could be anything from a cesarean or a removal of part of the bowel for other types of gut conditions. Poor quality of diet and lifestyle, eating a diet high in fermentable foods, lactose intolerance and constipation. So these can be all reasons why people may suffer from IBS type symptoms.
I often see people, I don't know about you, Lee, but I often see people who've had gastroenteritis or food poisoning, which has caused gastroenteritis. And as you quite rightly said then, it might be years ago, but when you do a detailed case history, you realise that actually that's when their symptoms started to get bad and they may have progressed and got worse with old. So I think gastroenteritis and food poisoning is a very important thing to look back at in the case history.
Absolutely. So we often get asked the question when people come to the clinic, what is a normal stool? So in terms of normal stool consistency, it's anything between sort of type 3 and type 5 here, which is shown on the Bristol stool chart. And that's kind of a soft form stool, which can easily be passed. In terms of how often is normal, well, some of the guidelines suggest it's going to open your bowels 1 to 3 times a day, or as little as 3 times per week. But we often say it's actually looking at what's normal for you, because everyone is quite different, aren't they?
Some people may have always only had one stool every 2 days all their life. Other people may have been having 3 stools a day, and for them that's normal. I think the important thing is that if your stools suddenly change, you've always had stools 3 a day all your life, you suddenly become very constipated, or you've been very constipated and you suddenly start getting more stools and more diarrhea, that often is what we consider a red flag, and you need to go and see your GP about that.
Absolutely.
So dietary advice for IBS. Well, if we look at the guidelines for that, well, the first thing we would suggest to people is that they have a really good look at their alcohol intake. And that might not be relevant for everybody, but I think it's very important to see how much alcohol you're taking in. The evidence suggests that it can cause or worsen IBS symptoms. Research suggests that it may cause loose stools, abdominal pain, nausea, indigestion, and particularly in women if it's taken in excess. The question would be, could a reduction help your symptoms? I think fundamentally, it's about keeping within the national guidelines. So here you can see how many units you're supposed to have. But it may be that for you, that's all that you need to do is change your alcohol intake, and that might be enough to help your symptoms. Equally, we go on and we look at things like caffeine. So caffeine in the diet, there is some evidence that suggests that coffee may cause or worsen IBS symptoms. If you consume more than about 400 milligrams of caffeine a day, then it might be helpful to consider reducing it. And that's equivalent to roughly about the amount of caffeine in 4 cups of brewed coffee or 10 cans of cola or 2 energy shot drinks. And you'll notice the energy shot drinks are therefore very high in caffeine. So I would just be aware of that and see if simply changing your caffeine intake would be enough to change your symptoms. Spicy food would be the next area. And we know that there's evidence suggesting that spicy food may cause symptoms, particularly in men. It may cause abdominal pain, loose stools, or reflux. And spicy foods, interestingly, might actually have other ingredients in it. So say, for instance, you're having a curry, there might be other ingredients in that curry rather than just the chili that could cause problems. And for instance, things like onions and garlic, we now know are very fermentable, and anything that ferments in the gut can cause wind and bloating and abdominal pain. So sometimes it's not as simple as just being the chili in there. It might actually be other foods, and that's worth considering as well. High-fat foods may be relevant. Some research suggests that reducing your fat intake may be beneficial in relieving your IBS symptoms. This may be particularly relevant if you find you get abdominal pain or discomfort after eating. So moving on to probiotics. A lot of people, do you get a lot of patients asking about probiotics?
Yeah, they often want to say they found something in the health food shop and they're wondering whether it's worth taking to help with their symptoms.
And I do find that some patients will come back and say it made a huge difference to their symptoms. So for some people, it does seem to work. And certainly the national advice is to perhaps try one product at a time for 4 weeks, follow the guidelines from that manufacturer and see if it makes any difference. There is, however, very little evidence that they're likely to actually produce a substantial benefit to your IBS. They'll not cure it. So I think it's worth trying. But what I would say with probiotics is if you're making dietary changes, don't take the probiotics at the same time, because if you get better, you won't know whether it was the dietary changes or the probiotics. So do one thing at a time. So if you're going to try probiotics, do that separately. Then if that doesn't work, maybe you look at changing your diet. So lifestyle, this is very overlooked quite often. I mean, simple things like eating 3 meals a day, breakfast, lunch and dinner. And that actually allows the system to get into a regular balance. And I think it's so important that you're feeding your system at regular intervals. You can see the picture of the gentleman up the top who's obviously rushing to work, isn't quite dressed, having a coffee. It's the stressful environment that a lot of us live in now. We're racing from one thing to another, trying to fit everything in. And it means that we don't get time to sit down and relax. When you sit down and relax while you're eating, it helps you digest your food. Enjoy your food, enjoy that time, and don't rush it. Things like technology, of course, we now live in an incredibly technological age. And you can see this is a classic cartoon here with the father on his phone, the mother on a laptop, and the son on some sort of technical equipment. And it's so important that we have digital free zones now, that we have zones that are free of any devices at all. So people can just say, right, mealtime, phones away, everything away, let's sit and chat or just talk or just have quiet time while you're eating. I think that's really important, a stress-free zone.
Now, so we're going to go on to a topic. So we often in clinic have people come along who say in the past they've either tried a dairy-free diet or they've tried cutting out milk. So we're just going to try and clear up a few of the questions that get asked about this. So when we look at milk-based products and sort of irritable bowel type symptoms, it's not a dairy-free diet we're looking at. So a dairy-free diet looks at taking out any food products which contain the cow's milk protein. Whereas when we look at irritable bowel syndrome, it's more to do with the lactose contents in those products. So lactose is a sugar that you find in milk and milk products.
I think that's caused a lot of confusion, doesn't it? Because for a dairy-free diet is normally used for people who have dairy allergy. That is totally irrelevant for irritable bowel syndrome. You do not need to do that. all you need to do is reduce your total lactose, which is the sugar, as you quite rightly say, in the milk. So completely different and often causes a lot of confusion. It is just the lactose, which is the sugar in milk, that you need to reduce, and you don't even need to completely eliminate it. You just need to reduce it for IBS.
So in IBS, some people who have noticed symptoms associated with sort of an intake of milk may find a low lactose diet beneficial, but it also is more relevant to you if you have suffered with IBS, which is diarrhea dominant, if you've ever suffered with gastroenteritis or food poisoning, if you've had any damage to the small intestine, either through conditions such as celiac disease. But additionally, people from ethnic backgrounds have a higher incidence rate of lactose intolerance and may find trying a low lactose diet useful. Okay, so if we actually to look at sort of the low lactose diet for IBS, it's remembering that it's not a dairy-free diet, and you can use some of these lactose-free milks which are pictured here. So these lactose-free milks, they are cow's milk. They've just had an enzyme added in to break down that lactose sugar up for you. So if you're going to try a low lactose diet, you could use some of these lactose-free alternatives. You could also use some of the plant-based milk. So here we've got a picture of the almond and the hazelnut milks. And there's also lactose-free options for things like yogurts and ice cream as well. But while you're on a low lactose diet, you can still eat things like chocolate, cream, hard cheeses, butter, because these are actually naturally low in lactose by the time they've gone through the processing. So you can also tolerate sort of up to 50 mils of milk or 2 tablespoons of yogurt on a low lactose diet. So for example, if you're making a cup of tea, you could use normal cow's milk to make your cup of tea. However, if you were having a large milky drink or a milkshake or making a sauce, you would benefit from trying one of those low lactose options.
So definitely not dairy-free diet, is it?
Definitely not. So if you do notice symptoms associated with milk and milk products, you could try 2 weeks on a reduced lactose diet using some of the information we've just discussed. And that's going to involve swapping your normal milk and yogurt for the lactose-free options. But you should continue to eat normal cheese, cream, butter and chocolate as you would normally. And then after those 2 weeks, if you don't see any improvements in your symptoms, it's really important that you stop the diet and return to your normal products. However, if you do see an improvement, at that point, you still want to look at reintroducing those foods back into your diet to help assess your tolerance levels. So for example, if you have been following the low lactose diet for 2 weeks, you see a significant improvement in your gut symptoms, you may then start off by gradually increasing the amount of normal milk that you've been having to see what happens to your symptoms. So you can assess how much normal milk you can take before you sort of develop those symptoms. Now, if you're concerned about your calcium intakes, if you're following a low lactose diet, it's remembering that those lactose-free alternatives, so things like the lactose-free milks and the yogurts, as long as they're not the organic versions, they will contain the same amount of calcium as your normal dairy products. So things like lactose-free milk will have the same amount of calcium as normal milk.
It is actually just normal milk, hence this picture of the cow on the side. It's literally, they've added lactase enzyme into it to help you digest the lactose. So yeah, it is normal milk. It will have all exactly the same calcium levels as your milk that gets delivered by the milkman.
And additionally, if you decide to use those plant-based milks, as long as you go for sort of the non-organic version, so avoid the organic ones because they're not fortified, but as long as you go for a non-organic version, they'll also contain some of the calcium. However, if you struggle to use sufficient amounts of those alternatives, you may want to consider a daily calcium supplement. And attached to this webinar on our website, you can download a fact sheet on calcium intake, which you may find some useful information on.
Okay, so the truth about gluten and IBS. Now, this is not necessarily in the national guidelines, but this is in reality a question we get asked a lot in clinic. Do you, Leah?
Absolutely. I often see people who come along and they've said that they've already tried cutting out bread for a few months sometimes, or they've tried reducing their intake of pasta, and they've noticed that when they have a big pasta meal, they bloat.
I get that a lot, and people, particularly with bread, they'll say bread makes me very bloated, for instance. And so a lot of them are already trying low gluten diets, and I get patients quite often who come to me who may have been for several years on a completely gluten-free diet, even though it hasn't cured their symptoms, and they're still on the gluten-free diet. So I think it's important for us to address this area in the webinar. So if you're confused about gluten, we thought it might help to just make it a bit clearer. So gluten can be associated with something called wheat allergy. Now that's something that where the immune system's involved, Things like baker's asthma is caused by an allergy to a protein in the wheat, and it tends to be a part of the gluten. So totally unrelated to irritable bowel syndrome. It's an allergy. That's a very separate thing. Gluten sensitivity, there's lots of research coming out about this. We think it involves the immune system. We think it involves gluten. There's still not much understanding about it fully. We know there's something going on, but it's not relevant to IBS. Celiac disease is an autoimmune condition where gluten affects the lining of the gut. Again, absolutely nothing to do with IBS.
I think it's just important to note that all those three conditions involve the immune system in some way and are related to gluten, which is a protein, isn't it, that you find in those wheat, barley and rye products.
That's a very, very good point. Yeah, absolutely. And then fourthly, you've got fermentation. And this is what I would call plumbing, a plumbing issue, IBS. It's where you're having wheat products, wheat, barley and rye products, and they are fermenting in the gut. And that is due to something called the fructans in the wheat, barley and rye, nothing to do with the gluten. But with IBS, this is the area that's more relevant. So if I explain again, so if with a gluten-free diet, gluten is indeed found in wheat, barley and rye, but gluten has nothing to do with IBS. Wheat, barley and rye also contain this carbohydrate called fructans, which is a fermentable product that reaches the gut. Fructans are actually poorly absorbed in everyone, so nobody has the ability to break them down in the small intestine, and they cause fermentation, which will then cause the IBS type symptoms. And actually, I find I get patients in clinic who say, you know, I listen to my stomach, it's gurgling, it sounds like a fermentation factory. That's that sort of fermentation going on in your gut, and that's caused by the fructans in the wheat, barley and rye, not by the gluten.
I think it's just important to note that those fructans are poorly fermented in everybody.
Yeah.
It's just that people with IBS often are more sensitive to the outcome of that.
Yeah, absolutely. So for IBS, it's the fructans in the wheat, barley and rye as well. It's not the gluten in the wheat. So it's nothing to do with gluten. So what we wanted to do is, rather than you trying a gluten-free diet without any guidance, we wanted to just give you an idea of what you could possibly do if you felt that wheat was causing you problems. So if you notice that wheat or the fructans in foods possibly are causing problems, you could try 2-week reduced fructan diet. That would mean cutting back on your bread, your pasta, your wheat-based breakfast cereals, your cakes, your biscuits, etc. But you must replace this with alternative carbohydrates, things like rice and potato and oats, quinoa, buckwheat, polenta, etc. All absolutely fine. And you could, of course, use the gluten-free food in the supermarkets, because that has no wheat, barley and rye and therefore has no fructans in. So we can't find fructan-free food in the supermarket, but you'll find gluten-free food. So you're in effect piggybacking on the back of the gluten-free food with IBS and saying, right, okay, I know the gluten-free food has no fructans in as well, so that's useful for me. So you could try those. Really important that if you don't see an improvement after that 2 weeks, that you stop the diet. And if you see an improvement, reintroduce the foods back to the level of tolerance. But if you think your diet overall has been compromised, it's always worth considering taking a daily multivitamin and mineral tablet while you're on the diet. So which of these diets is most relevant when treating symptoms of IBS? Is it a dairy-free, a low fructan, a low lactose, or a gluten-free diet? It is B, the low fructan, and C, the low lactose diet. The dairy-free and the gluten-free are not relevant. It's all about low fructan and low lactose. Okay, so now we've covered some of the main areas. We want to look at specific helpful hints for constipation or diarrhea or bloating and wind.
So if your main symptom is constipation, it's really important that you ensure that your fluid intake is at least 1.5 to 2 litres of non-caffeinated fluid per day. So that's between sort of 4 and 5 kind of pints of fluid a day. It's also important to look at your fibre intake. So you want to ensure that you have plenty of high fibre starchy foods. So that includes things like oats, oat bran, brown rice, wholemeal, seeded, granary breads, whole grain pastas, couscous, potatoes with the skins on. And it's also been shown to be really helpful to try to introduce some linseeds into your diets. So linseeds are tiny, tiny little seeds which you can get from big supermarkets or health food shops. And we recommend starting off with just adding 1/4 to 1 tablespoon a day, and gradually increase your intake up to 2 tablespoons a day. And you can sprinkle them on things like your breakfast cereals, yogurts, salads, casseroles. But it's really important that when you take them, you also have them alongside a large glass of fluid, so at least 150 mils of fluid at the same time as taking those linseeds.
And you can have them ground or whole, can't you? And
Yep.
golden linseeds or brown linseeds, any of those are absolutely fine.
Yep, and like I said, you should be able to get them readily available in health food shops and some supermarkets. If you want some more information about how to increase your fibre intake, there is the downloadable fibre fact sheet which you can get from our website, patientwebinars.co.uk, and that was being produced by the British Dietetic Association. But if you are looking at trying to increase your fibre intake, make sure you do it gradually.
But what if your main problem is diarrhoea? First of all, I'd say ensure you replace your lost fluids. You may also find it helpful to limit your intake of tea, coffee and soft drinks to about 3 a day, and try reducing your intake of the high fibre foods such as whole wheat foods, such as some of the breakfast cereals. You could even try avoiding some of the sugar-free mints and gums and drinks that contain sorbitol, mannitol and xylitol. All of those things may help. And then we do get a lot of questions from people about advice on bloating and wind specific to those particular symptoms. So we suggest that you limit your intake of the gas-producing foods such as beans, pulses, sprouts, cauliflower, etc. And limit your intake again of the sugar-free mints and chewing gum because they can definitely cause wind and bloating. And you may also find it helpful to eat oats and linseeds, much as the constipation advice have 1/4 to 1/2 a tablespoon of linseeds and increase up to 2 tablespoons a day, always ensuring that you drink enough water with that. And of course the linseeds could be golden brown, whole or ground.
Okay, so going on to a topic called the low FODMAP diet. So the low FODMAP diet looks at a diet which is low in fermentable oligosaccharides, disaccharides, monosaccharides and polyols.
And I think it's important at this point to say that this is not what we would suggest you would do straight away when you're trying to tackle your IBS symptoms. But we want to make you aware of information behind this diet at this stage because it's so readily available out on the internet. FODMAP diet, something called the low FODMAP diet. People are constantly coming into clinic asking about it. And I think to do a webinar on IBS and not mention it would be slightly daft, really, because everybody coming into clinic now has heard of the FODMAP diet pretty much. And that's changed a lot. I don't know what you feel. For instance, in the last 3 years, I would say a lot of people coming to clinic had no idea about it. Now, it appears that most people coming into clinic have at least heard of it or have tried it.
Absolutely. I think one of the reasons for that is because there's such a growth of evidence that supports using the low FODMAP diet for IBS type symptoms that other healthcare professionals are aware of it as well. So in clinic, I'll often have people come along and say, my GP's told me to go on the low FODMAP diet, or even my practice nurse, my gastroenterologist. So a lot more people know about it and have heard about it. So it's just to kind of touch on that.
Yeah, we're not going to go into details about it. We do have a separate webinar on the low FODMAP diet. So we're just going to touch base on some of the salient points.
It's just really to say that low FODMAP diet has been shown to be effective in the management of some people with IBS type symptoms. We would recommend that you see a FODMAP trained dietitian because it is a complex diet and also it's not appropriate for everybody. So a trained dietitian can actually help assess you of how appropriate it is for you. If it's not possible for you to see a dietitian, and we know in some parts of the UK that's the case, and if that's the case for you, you can gain access to some reliable information from our low FODMAP diet webinar, which is again available on our website, www.patientwebinars.co.uk. But if you have been told about the low FODMAP diet, you may have come across a couple of these apps which have been produced. So there is the Monash University Low FODMAP Diet app, which was developed by the University in Australia where the low FODMAP diet originated from. It's really useful, but I suppose the main issue with that is it's based on Australian foods.
Yeah, a lot of the foods in the listed are very Australian. We wouldn't necessarily have them here in the UK.
Whereas there is now a UK-based app which has been produced by King's College in London, and that app's really helpful because it takes you through the different stages of the low FODMAP diet. There's lists of foods in there, and it's based on UK food, which is more helpful for
absolutely. And it has some excellent little videos that go with it to show you how to use the app, for instance, or how to manage the FODMAP diet. It's a very, very good app, and I'd say that I think it costs $3.99 or something a year, and it's absolutely worth it. Very good if you're finding it difficult to find a dietitian. It's certainly a useful useful area. But there are provisos or warnings with using these apps.
So both apps say actually it's really important to seek an advice from an experienced dietitian because the diet is complex. You want to make sure you go through each phases of restriction and reintroduction and personalisation, and a dietitian can help you with that. Okay, so if you've been told about the low FODMAP diet, you may have come across some of these Facebook and Twitter accounts. So the Monash FODMAP Twitter account is really helpful because it actually gives lots of tips and recipe ideas for following the low FODMAP diet. So that might be something to look at if you're trying to find some further information.
Even if you never do Twitter, I would say the Monash app, well, both of them, Food Maestro and Monash, would be excellent ones to join. The Monash one, although their app for doing the FODMAP diet has got Australian foods in, it may not be the best one for you to use, and the King's College one, London Better. When we're talking about using Twitter accounts, the Monash Twitter account is fantastic. Lots of very patient-friendly information on it, and Food Maestro as well, but really, really useful. New research coming out, different recipes. I would really recommend that if you just do Twitter for that, I think it would be worth it.
And also, just to mention, the Food Maestro one you can see here is the one linked to the King's College London.
Absolutely, and it's brilliant. Lovely videos on it as well. So a lot of people will ask if food allergy is relevant in IBS, and they will ask whether food allergy is causing their IBS symptoms. The two things are completely different. One is using the immune system, that's the allergy side, whereas IBS has absolutely nothing to do with the immune system at all. Therefore, allergy testing would be completely irrelevant. The trouble comes because food allergy symptoms, when they just affect the gut, can appear very similar to IBS symptoms. So it can appear quite confusing. So I think a lot of people feel that surely allergy testing must be useful, but it's not. Allergy testing is completely irrelevant for IBS entirely and won't help you at all. So if I'm asking you a question in the end, could allergy testing help you find a solution for your IBS symptoms? Yes, no, maybe, only with NHS allergy tests? The answer is absolutely a resounding no. It will be no use to you whatsoever.
So, in summary, if you have had a diagnosis of IBS, you may be asking yourself the question, what should I do to help myself? So, firstly, we recommend looking at your intake of alcohol, caffeine, spicy food, fibre and high fat foods. You also want to be considering your lifestyle, so making sure you take the time to sit down to eat your meals, relax, enjoy your meals, and ensure that's a digital-free zone. You may want to consider trying the low lactose diet for 2 weeks if you notice an association between your symptoms and milk products. You also may want to consider a low fructan diet for 2 weeks if you notice an association between high intakes of fructan foods and your symptoms. But it's really important to remember that if you follow either of those two diets, if you do feel better after that 2 week period, you still want to make sure that you slowly reintroduce small amounts of that food back into your diet to a level that you can tolerate. And it's remembering that neither of those dietary approaches are for life. And it's important to challenge yourself regularly with the food to determine if your tolerance has improved. So, for example, if you've done the low lactose diet, you've then gone through a reintroduction process and you found that you can only tolerate, say, 100 ml of milk before your symptoms come on, it's worth in a couple months' time to see if you can have any more at that point.
Yeah, I think how long do we suggest you trial the low lactose or the low fructan diet for before you reintroduce them back into the diet? Are we suggesting 8 months, a year, 6 weeks, or 2 weeks? We're suggesting just 2 weeks, not longer, just 2 weeks. So points to remember, only take out food groups for a limited time period of 2 weeks, and if no better, make sure that you reintroduce that food group back into your diet immediately. Probiotics may be useful, but presently there is limited evidence of their benefit, and they certainly won't cure your IBS. IBS has nothing to do with food allergy or the immune system, therefore allergy testing won't be any use. Low FODMAP diet apps may be helpful, but recommended, if possible, to see a specialist dietitian if you want to look at the low FODMAP diet. What should I do if this webinar fails to help my IBS symptoms? Well, assuming you've got an official diagnosis of IBS, then a specialist gastroenterology dietitian is the go-to expert on IBS and diet. You do want to check whether you've got any red flags, and we'll go through the red flags in a second, but fundamentally, the dietitian, a specialist dietitian, is the person you need to see. You don't need to go and see a gastroenterologist or a GP to look at dietary intervention for your irritable bowel syndrome. Just ask for a referral to a specialist dietitian. These are the red flags that we mentioned at the beginning, and we want to reiterate that if you've got any of these symptoms, you must go and see your GP as soon as possible. So blood in your stools, unexplained significant weight loss, unexplained low iron levels, sudden change of symptoms. We mentioned, if you suffer from constipation all your life and suddenly you're getting diarrhea, for instance, waking at night regularly with your gut symptoms, you must go and see a GP if you have any of those symptoms. We call them red flags. Don't forget that you can download all the handouts that go along with this webinar. The handouts are the British Dietetic Association NICE and IBS food fact sheet, the British Dietetic Association calcium food fact sheet, our FODMAP general information, constipation advice, and the Dietetic Association fibre fact sheet as well. Visit our website, patientwebinars.co.uk, and you'll find all the handouts on there. Really important today to finish is to ask you, please, please, please complete the post-webinar survey. This is so important because this determines what we do with our webinars in the future, and what information you want us to add and what you'd want to know more about, etc. They are incredibly quick, just a little tick box. It takes 1 minute, literally, if that. We'd be so grateful.
And thank you very much for listening, and we really hope that you found this webinar helpful. Don't forget about our website, patientwebinars.co.uk, and we have a Twitter and Instagram account at Patient Webinars as well. And goodbye from our team.